Ganglion cysts are common entities. They're benign lesions that are usually round or oval and found on the dorsum of the foot, usually within a tendon or over a joint area. They're usually like jelly-filled, and they can cause pain if they cause pressure over a joint or give pressure to a nerve area. And it can also affect joint movement. In this video, we actually see an individual with a cyst on the dorsum of their foot, and we can actually see as well a ultrasound image of it. The ultrasound image shows this lesion to be fluid-filled and stemming off of one of the extensor tendons of the foot. What I usually like to do is I like to highlight the area by marking it with a pen, and then anesthetizing around the area in a V block using local anesthesia. I like to use that mark around the area so that when I do fill the area up with local anesthesia, it doesn't eliminate the area as much, so I could see exactly where it is. I then utilize an 18 gauge needle to basically poke a hole into the top of this fluid-filled mass. I always try to drain it by just pulling on the end of the syringe to remove any fluid. But if that's not possible, as you can see here, what I was doing, I was just trying to eliminate as much of that gelatinous fluid as possible. And as you can see, there was quite a bit. As we remove that gelatinous fluid, you can start to see that there is redundant tissue where there was once this space-occupying lesion. It's quite gratifying for the patient as well as for the physician to get rid of this, and you're left with this little defect. Afterwards, what we'd like to try to do is to make sure there's some compression to that area, and we utilize a dressing that is quite snug to try to decrease the amount of pressure to that area. We also tell patients that, following this procedure, we want to make sure that there's nothing that's rubbing on that area that can maybe cause this to come back again. And we also give the patient realistic expectation, letting them know that with time it's possible for this lesion to reoccur. Some of the newer things that we've been doing with these type of lesions, if they do recur, is to utilize extracorporeal shock wave therapy, ESWT, in that area. And we've gotten some great results where utilizing that keeps these lesions from ever returning again. Thank you.